Episode 2, FRCS Vascular Surgery Section 2. How the clinical and oral exam really works. Hello everyone, this is your host Momia and welcome back to the Proximal Control podcast. In the last episode, we covered Section 1, the written SBA exam. Today, we are moving on to what many candidates find the most demanding Section 2 of the FRCS Vascular Surgery. This episode is not about revising topics, it's about understanding how the exam is run, how you are marked, and how to score marks safely and consistently. What is Section 2? Section 2 is the clinical and oral exam designed to assess whether you can function as a Day 1 consultant vascular surgeon. It is held over 2 days. Day 1, oral exam. Day 2, clinical long and short cases. Each section is structured, standardized, and independently marked by examiners working in pairs. The components, what you will face. Clinical long case. There will be 2 long cases, 20 minutes each. You are assessed on history and examination, interpretation of findings, investigations with appropriate imaging handed over to you and you will be asked their interpretation, management options and complications, communication and structure. This is not a word round. This is about clear consultant level reasoning spoken calmly and logically. Now come to clinical short cases. There will be 4 short cases, 10 minutes each, focused on interpretation, management planning, structure and prioritization. You do not need to be flashy, you need to be safe, structured and decisive. Now next come to oral examinations, which will have 4 stations. Each oral station lasts 30 minutes and move quickly. They include case-based discussion, which will cover aneurysm and lower limb, case-based discussion, which will cover endovascular and miscellaneous, emergency vascular surgery, and the last station will have elective and academic foundation. These stations are fast-paced. Once you leave a station, it is finished. Do not replay it in your head. Do not try to correct it mentally. The next station is a new exam with new examiners who know nothing about what just happened in the last station. Next, we talk about the marking system. This is critical. This is where many candidates lose marks without realizing it. Each interaction is scored on a 4 to 8 scale. 6 is pass marks. Score below 6 indicate unsafe or poorly structured performance. Scores above 6 reflect increasing consultant level competence. You are assessed across 4 domains. First domain is basic knowledge. Second, higher order thinking, which includes judgment, prioritization, decision making. Next is clinical skills. And the final domain is professionalism and communication. There are 96 marking events in total if you combine all of them. And the total pass marks, as I said, 6 in each marking event will be the pass marks. So it will be 576 in total. There is no requirement to pass every station. You can compensate across stations. So, if one station felt weak, park it and move on. That advice is explicitly built into the exam design. Now let's talk about this important topic. How to score marks consistently. Examiners are not looking for perfection. They are here looking for logical structure, safe prioritization, clear justification, calm and professional behavior. A structured, safe answer will always score better than a clever but disorganized one. And professionalism really matters. Respectful communication, empathy with patients and volunteers, awareness of ethical issues are really important. Poor attitude alone can drop a competent answer into a failed category. Now let's come to the exam environment, what it feels like. Day 1 is intense and really fast-paced. Day 2 is longer but steadier. There are breaks, use them, eat, hydrate. There will be tea and coffee in the sitting area. Reset your mind, train yourself to think. This is a new exam, fresh start. This thinking will really help you to move on. That mindset alone saves candidates every year. That's our section 2 overview, not rumorous, not hearsay, but how the exam truly runs and how it's marked. In upcoming episodes, we will break down each oral station, long case structure, emergency viva frameworks, academic and trial-based question. If you have questions, leave a comment or reach out via the channel. We will address them in future episodes. Thank you for listening to Proximal Control. Whether you are sitting FRCS Vascular, European Board, or any other international vascular exam, I wish you the very best, because in vascular surgery, control is everything.